All right, listen to this. 1 in 4 women are dealing with hair loss right now. That is according to the CDC. And now there are even more options to help you regrow your hair. Here to show us where we can start is dermatologist Dr. Mary Hurley. Dr. Hurley, thank you so much for being with us this morning.
My pleasure. Thank you for having me.
Well, I want to start with what women should do right now if they are experiencing hair loss. Because a lot of times you see this start to happen, you don't really want to say anything. There's some shame associated with it in many cases. So where should women start if they're experiencing this?
Well, women experience hair loss. It is very stressful and anxiety provoking. So the first thing I tell my patients is don't stress about the hair loss. That's the worst thing you can do. But where they should start is by seeing a board-certified dermatologist. We are the experts in skin, hair, and nails. And hair loss can be a complex diagnosis, so it requires a complete workup, which includes a history. So asking how long has it started, is it precipitous in onset or slowly progressive, any family history, any new medications, and then any major stressors.
And once you get all that information, of course, I'm assuming there are many different types of hair loss. So what are those different types of hair loss?
There are many different types of hair loss. So one of the most common is the genetic pattern. It's called androgenetic alopecia. Both men and women can get it. There are there's a stress-related form. It's called telogen effluvium, and these are after major stressors. So general anesthesia, death in the family, COVID. We saw a lot of hair loss.
Yeah, and if you have surgery, hair loss. I experienced that. I had 2 major surgeries in a year, and I experienced that as well.
Yes, and actually after pregnancy. And so it doesn't happen immediately after you have the baby or the stressor. It happens about 4 months later. And so it has to do with the way that the hairs cycle from a growth phase to the resting phase, which is called telogen, and people can bring in their hair, and I can look at it under the microscope and see the...
So can hair be regrown? That's the big question everyone wants to know.
Yes, and the sooner you come in, the better. So there's 2 different types. There's scarring alopecia, and that's where there's loss of hair follicles. And so once those follicles are scarred down, then there's no opportunity to regrow. And then there's non-scarring, and those are some of the things we talked about. And yes, there's lots of options.
Well, let's talk about the over-the-counter options that are available. You have some examples here. I'm going to tell you right off the bat, when I did experience that, had 2 surgeries, my doctor put me on this just as a preventative, and it really works. I still take it. This is a great option.
This is a great option. So there's several different ones, obviously, for men, premenopausal, postmenopausal women, and people notice significant improvement.
All right, and what are these here?
So this is a kit that we have in our office. It's professional grade, so all of these are things that you can get in a medical office and or by prescription, and they're much higher concentrations than what you can get over the counter.
That's amazing. Well, you did say when you started that this can cause a lot of stress. So the first thing is, ladies, don't stress about that. There is help. You have actually given us so much hope, because I know a lot of ladies watching are probably thinking, okay, take a deep breath now. I need to get in with my dermatologist. Dr. Mary Hurley, thank you so much for being here this morning. It is such a pleasure to have you.
Thank you. If you want to be hairy, come see Dr. Mary.
I love it. I love it, Dominique. If you want to be hairy, come
see Dr. Mary. It's the best line of the morning. Thank you so much.